been a while since I've done a video. Why is that? Well, let's have a look and see. Two little anecdotes I'll throw at you while you're looking at this view back east, and I suppose that's sort of south-west. Pasties, I had a best pasty I've had in a long time this morning at Delamere General Store near Cape Jervis. Pepper pasty, never ever seen one that before, that name. That was absolutely terrific. So if we go to Delamere General Store, we'll go through it, drop in there and grab a pepper pasty, yummo. Pages Lookout, just isn't too far from that walk. We just did the Deep Creek walk, not that we got all the way down Deep Creek. Rocks over there meant to have a whole bunch of sea lions on. Picture says, and in the right season you can see the southern right whales from here as well. That's what that sign says. Second anecdote. Well, you're going to have to wait till probably, I reckon, June, July to find out more about that. I'll drop a video then, and I'll bring this bit of vision back to you, just to remind you if you keep on watching through to then. 24th of February now, so we're probably 2 months, 2 weeks away from surgery in Western Australia. A place called Drakefield Winery at the moment. Been over here on the summer tour, probably the last week or two. Knees blown up a bit, sort of affecting the muscles, I suppose. This is my experience anyhow. The calves and the back of the thigh getting really sore, and Voltaren cream and tablets are doing a little bit to help, not too much. Pretty restless nights. Got a referral from the orthopaedic surgeon for some injections. That's some steroids, I think, into the knee under ultrasound. I have to wait till the 7th of March in Adelaide for a steroid injection. When I was speaking to the orthopaedic surgeon, he said the cut down the front here depends on how much they need to get the knee out, I suppose. So it could be small or it could be large. My guess it's going to be from about here, probably up to around about here. So it's going to be a fairly long one, I think. I've got pretty big thighs too and calves, so. Just been in at Benson Radiology, bit of steroid injected there, see it's all red. Bit of local as well. I reckon it'll settle down after a day or two. Hopefully relieve the pain. Well, we're not quite in April Fool's Day, but we're hours from it. So Shepparton had a CT scan done there at IMED. It's part of the knee replacement. They call it a med-actor protocol thing, so I don't know what that means really. It's just something they do. Today, dropped in at Sale and had some x-rays. And they did x-rays like really from the hip down to the ankles, both sides. And I think from what they told me, they stitch up the pictures to see whether the left leg's longer than right leg or vice versa. But anyhow, do that, and that's part of the knee replacement. 2 days out. It's Wednesday. Since the last vid, when we left home, I've had bloods at Sullivan Nicolaides. Spoke to the hospital, the private hospital. They want some extra bloods, urine tests, skin swab for staff, so a couple of extras. Yesterday, Tuesday, spoke to the anaesthetist, talked about medical history, the procedure that he's going to do. Sent an email off to the surgeon's rooms. They got a video I've talked about already, where they mentioned surgical sponges to have a shower the night before and then the morning of. So I'll pick them up today from their rooms, and they also mentioned some medication night before, morning of as well. So I'll have a chat to their nurse today. I think I've got a telehab or telehealth thing with her today. We head up to Warana today, so we're in Brisbane. Head up north, see how we go. Spend the night there, and probably get a phone call today as well telling me what time we're going to be in the hospital tomorrow. Just across the road from the hospital. Pick up a couple of sponges yesterday from the orthopaedic surgeon's surgery. Sponge bath last night, shower tonight as well, or this morning. Just after 6, in at 6:30. Day of mission surgery, first floor. Here we are in prep. Gown, undies. Surgical stock goes on non-operative leg. Again, guys. Probably went into the theatre around about 9ish, I think, and they woke me up just after 11:30. Still on the heavy drugs, which is pretty cool. Left leg's okay. Move it around, right leg's still a bit numb. There was a bit of a spinal tap and some other local stuff, so it's all looking good at the moment, but I've been told it's not going to get any better. Yeah. Cheers.
Now while you're up?
Yeah, I've already spoken to the nurse.
Beautiful. So I'll just pull off.
Before I take this away, Ken, would you prefer to shower on this chair or the toilet frame?
Oh, I'll try the toilet frame.
Thanks, thanks.
Bring you of things before we move.
Can't
There we
lift this
go.
leg yet.
That's alright. That's what I'll do.
Try it.
I can help. Thankfully, it has a pain relief.
Yeah, those tips on
Endone. Endone? How's that head?
About the same as when I was thinking.
Okay.
It's probably the end.
Is it attached? Yeah. So obviously just let me know if you do get dizzy. Otherwise, come on out and turn left. Did you go? Head's fine? Beautiful. It's nice to move, isn't it? And if you want to hop up for a walk, you can. Okay, just grab this and you can come on out. If you feel like you need to move, we'll set your room up so you can sit up in the chair as well after the shower. Have a bit of time up, out of bed.
There you go, on day one. Well, 2 hours shy of day one anyhow. A bit rough last night. The drugs were pretty cool, especially the night ones. Got about 4 or 5 hours sleep, which is probably more than I expected. Gonna get up and have a shower this morning, do a bit more physio, and see how we go. Pain. Get on those drugs if you can, and they say keep ahead of the pain. Get on the drugs. Sunshine Coast University Private Hospital. Super ensuite. TV, not that I've watched it. Reclinable bed, ice bucket, like an ice man I suppose. And a strap that goes around my knee. This is a local anaesthetic from what I understand. The way they explained to me, it's like a little drip goes in against the nerve that the pain receptors for the front of the knee and the side, not the back. Can't overdose it, only let you well, it'll only administer 1 dose every 30 minutes. It does provide some relief, which is pretty cool. So I've just been for a walk, just had a shower as well. And I sit down in the big chair. Relax a bit. I came out of surgery, well, I remember being in the recovery area at 11 o'clock, and after a little bit I was wheeled up here. A few visitors, occupational therapist, physiotherapist. When I was in recovery, the surgeon And 3 o'clock they had me go for a little walk. Not a very long one, but up in here. Don't know if you can notice. Have a look. That's like, I'm not fixing my legs. It's swollen to buggery. To be expected, I suppose. It's been bashed around a bit. Wearing some stockings over there by the sink for DVT and some shoeies. I think they're bloody socks. Come in 2 sizes, small and large. They're just a little bit too small for me. Cut off the circulation in my feet. I did have some like air inflator thing around both feet, and it was connected to this little pump up the back here, and it'd pump air into it, hold it for a little bit, let it out, and I'd do the other foot. That came off last night after I bitched and groaned about it hurting my right foot too much. When do I get out? A couple of things I need to achieve. I need to be able to bend the knee at 90 degrees, like lift it off the ground and bend it. At the moment I'm finding it pretty hard to get off the ground. That's about it there, a centimetre, and I can't do it on the bed at all, like in a horizontal plane. That's one thing. Be able to walk confidently with crutches. I haven't got the crutches yet, still got this monster thing. Be able to do ablutions, showers, toilets and stuff like that. Occupational therapist have organised a shower seat. At the moment expecting 3 nights in here, maybe 4 nights. So I went in on Thursday, so today is Friday. So I'm hoping for a Sunday discharge or a Monday discharge. Discharge times are like hotels, 10 o'clock. So it really depends on how I go today and how I go tomorrow. At the moment I'm feeling like it's going to be a Monday. Talk to you about pain. Good drugs here. They do give me endome, fast relief medication when it starts getting a bit wild, and this little thing doesn't provide much relief. And there's a bunch of other pain things they give me as well, but the endome's probably the kick in the arse one. Knocks the pain out, which is cool. Night time they give a long-lasting or long release endome and a bunch of tablets, and that wasn't too bad. Don't know if I mentioned it, 4 or 5 hours sleep last night, so it's a couple of hours more than I expected. Had some bloods taken today, and I think I'm going to get x-ray done as well, so they can make sure that the new joint is in okay, it's not doing anything wrong. And I think I've got another physiotherapy session later this afternoon too. Well, I've progressed from that walking frame to crutches. You'll see them just down there. Just went and did another 80-metre sprint on crutches. A couple of leg exercises in the bed. Trying to do leg raises, pretty hard. Hurts the quad right up here. Had a quick chat about expectations of discharge, and my thoughts were probably Monday, so Thursday to Monday, what's that? 3-4 days. Physiotherapist said that wasn't unrealistic, maybe even Sunday, but we'll see how we go. Still got the weekend ahead of me. Yeah, you're reading the clock right, 1:35. The little O pump that I had in, they've taken that out, so I can't get any sort of short-term relief. Just got the nurses in to get me another endome. I think the prescription that the pain doctor has given me allows me to have 10 milligrams, it's 2 tablets every 4 hours. Yesterday I think I had 2 in the morning, 1 at 3 o'clock in the afternoon, and then another one at 8:30. So it's been about 5 hours since I've had one. Yeah, same day, about 5:30. Leg's not very happy, just took some more drugs. get it moving a bit, I think. Change posture, see if that relieves the pain a bit. It's not fun. Sunday morning, what is it, about 4:15? Not a bad night tonight. It's last night. Without my doses, I had a good sleep from 8 till about 12:30, got up, had a pee, back to bed and just got up and had another pee. Ice needs to be changed. Well, there's probably no ice in the ice bucket. See if I can get one end done as well. Just to knock the pain that's there at the moment off. A little bit later in the morning, 7:05. Sore back last night. I got given a bunch of those, 4 of them, help the back. Pretty cool. Just place them, I scrunch them up. It's a chemical reaction, a lot of heat, and just put them on my back. Helps lots. Leg's not feeling too bad, a little bit sore. Just been for a little bit of a walk. Gonna go for another walk. Sunday, about 10 o'clock. After having a visit from the doctor who hands out the pain medication. He was happy enough for me to go home, so I've just been waiting since then. That was probably about 7:30 this morning, I think. Waiting for some meds to turn up. Been through the paperwork with the hospital staff here. Just a bunch of stuff. A little card talking about the implant. I suppose that's if you go through borders and checkpoints and stuff, it's great. Discharge summary for the doctor. Just waiting now for some drugs. A few days later, it's now Wednesday, so 6 days after surgery. Meds still, crutches still, walking around sort of. Pain medication's been pretty good. The most savage pain was probably, like the surgery was on Thursday morning. It was probably Friday afternoon through Saturday morning. So probably about 24 hours, between 24 and 48 hours after surgery. I thought it's been pretty manageable with drugs. Exercises, I'll go through some of the exercises they've given me. So what's involved. Leg raises, calf raises, squats. Anyhow, I'll show you short. What's a sleep been like? Well, for me, the oxycodone knocks you around a little bit, knocked me around a little bit, so I'm sort of in bed by 8:30. That last night was an exception. Usually up at midnight, take a couple of oxycodone, 1 or 2, and that usually sees me through to about 6:30, 7 o'clock in the morning. Then take my daily doses of all the tablets. About 7, and dinner time. About 6:30, take a nightly dose as well of all the tablets except for aspirin. It's been pretty consistent, I think. Yesterday I slept through to 2:30 in the morning. This morning it was about 2:30 as well, got a couple of oxy. Thursday, 1 week. Last night was the first night I went through the night without any additional drugs. So 7 days. I think I've already mentioned sort of run out of drugs tomorrow morning. So we'll see how we go today. Last night went through the night, as I said, without any additional drugs. Did wake up a few times, Had a very sweaty sleep. Don't know what that was about, but anyhow. Pain's been pretty good. Well, it was from yesterday. I was a bit restless once I got into bed. Once I got comfortable, it was okay. Been keeping the ice up on the leg. Don't know if I've mentioned this yesterday when I was doing exercises. Managed doing leg raises, full extended leg raises for the first time. I think probably in over a year now, so well before surgery as well. So that's certainly a marked improvement from where I've come from. So about 8 or 9 days out of surgery. Seen physio twice now, so just an update I suppose. Show you those exercises. I've been given a towel under the knee. And what I do is it's an exercise to get the legs straight and toes towards me, and just lift the knee up, hold it for 5 seconds. Rest. 1 set, 15 reps. I'll split it up into 3 sets, 5 reps each. The second exercise, I'll show you what that is. I've already told you before. It's just leg raises. Same, 1 set, 15 reps, but I'll split it up into 3 sets, 5 reps. Told by the physio, breathe out, toes toward you, helps. Third exercise, a bally ball. That's right, it's good on the bed, at least it's a bit more comfortable. And this is just to get some movement on the knee, some flex. Roll it towards me, and I've actually been using my hand to try and help pull it back a bit as well. Hold it there for 5 seconds. Again, 1 set, 15 reps, but I've been doing 3 sets, 5 reps. Alright, that's the exercises. What else has happened? Dropped off the endone last Thursday or Friday. These pills here. A lot of swelling, bruising happening too, around there, and lots around the ankle. Lots of swelling down on the calf, and say the swelling there all the way up through the hip. Apparently that's normal, and sometimes the back as well. And our GP Wednesday, have a chat to her and get this checked out. If she takes this off and redresses it, get to see the size of the wound, then measure it up, tell you how much it is. Talk to her about drugs, pain management, sleeping. Give you a report back then, eh? Yeah, had the OT in today too. Occupational therapist. She's going to give me a couple more things. A seat that's a bit more easier to sit in and get out of. Took a measurement for the stockings as well. Calf, right calf, that's a surgery one. 6.5 centimetres, no, 1.5 centimetres bigger than the left one. Before surgery it was a centimetre smaller, had wasted. Knee, 6.5 centimetres bigger than the left one. Didn't do a measurement around the thigh. This is about where I am at the moment with my knees. Where do I need to be? Let's have a look. So quite a bit more difference yet. Asheville Country Practice. First checkup. I should take this stuff off, eh? Yeah, ask about the stockings today as well. Iceman's turned up at the physiotherapist place as well, so I'll pick that up and show you that a little bit later as well. It's the same as what I had in hospital, I think. Off to my fourth physio visit, down to one crutch now, and progress to the front seat with the adults. It's Monday. Last Friday I went there, and he checked me up. Said I had about 80 degree bend in the knee, 40 degree improvement from where we started. I think I've already mentioned this, aiming for 120, 125 degrees. Pretty relaxing weekend. Walking at the moment, 2 crutches still, around the neighbourhood. Probably went for about 1 kilometre this morning. This afternoon I'm going to try and walk down to the beach. That's the end of my 4th session with Jeremy. He's pretty happy with the progress, which is sort of positive news. You always like that sort of stuff, I think. Well, I do anyhow. Positive reinforcement. Gave me a different exercise to do for knee stretching. He reckons the knees he got it to 90 degrees today, so he tells me. He's pretty happy with that. So it's just a matter of keeping up the exercises, and once that wound's healed properly, then you can start working on muscle sort of restoration, I suppose, because there's still a lot of swelling, particularly in the quad up this side. And you can't work on the muscle until such time as the wound's properly healed. Going to probably mention this. Going to take the dressing off this Thursday and have a look. That'll be 3 weeks. 20 days post-surgery. Last week and this week I come down here. There's Gold Coast Physiotherapy doing yoga down here, but I come down here and do a little bit of, talking really fast, aren't I? Doing a little bit of exercise as well. Incision is 18 centimetres long. I'll drop a picture in here, you can have a look. Picture makes it look probably a lot worse than it is, but 18 centimetres, you can see that on the tape. Healing pretty well, I think. Leaving the dressing off now. Where are we at? I think I already said this. Wednesday. So we're 20 days out from surgery. Still taking Panadol every now and again. Still got some, well, I've only got 1 Plexia left. I've been taking them just before going to bed. Last night, well this morning, probably about 3 o'clock, I took an endone. A little bit sore. The previous 2 nights, no endone. So I'm just managing it as it goes, I suppose. It's generally pretty good during the day. Try and get a little bit of ice on it. Yesterday with the Iceman, I probably put it ice on for probably 5 or so hours, I suppose. Walking. Yesterday I think I did just a bit over 4 Ks walking during the day. Day before about just over 3 Ks. Previous days a lot less. So just building up the fitness. And walking, still walking with 2 crutches. At the moment just 1 crutch. But on those longer walks with 2 crutches. I think I'll end this video here. I'll do an update a little bit later. I've got a appointment with the GP in I think it's 3 weeks, just to review pain and the recovery of the scar, the healing I suppose. And I've got an appointment with the orthopaedic surgeon at the 8-week mark, so it'll be another 2 weeks after that, so 5 weeks from today. And I'll update you at that stage, eh?